Hi, my name is Harriet Frew. I'm an eating disorder therapist, a member of the Counselling Directory and host of the Eating Disorder Therapist podcast. Now today I want to talk to you all about bulimia nervosa, talk a bit about what it is, some of the signs and symptoms to look out for, and to then talk to you about how counselling can really support you to overcome bulimia nervosa. Now, I have a special interest in bulimia as I've recovered from bulimia myself. I had the illness for almost a decade, from my late teens into my early 20s, but I've been recovered now for many years, and I've actually been working in the NHS and in private practice for, nearly 20 years, so a long time. So what is bulimia nervosa? So bulimia nervosa is an eating disorder. When someone has bulimia, there is a strong preoccupation on weight and shape. Underneath this preoccupation is often a feeling of not feeling good enough, and bulimia has become a coping strategy. So by controlling weight and shape, it's a way of almost temporarily feeling good enough, feeling a sense of control, feeling distraction or numbing from emotions. So it's a kind of a life raft to cling to when maybe life is stressful and out of control. Now, when someone has bulimia, often it starts off with restrictive eating patterns, which then very quickly someone will fall into patterns of binge eating and then purging and getting stuck in relentless cycles. So what we mean by binge eating is eating a very large amount of food in a small amount of time. There's often a lot of secrecy and shame around these eating episodes. After someone's had a binge, they might feel intense self-loathing and disgust and then want to get rid of the food. So they will often do this through purging, which can be through self-induced vomiting, can be through over-exercise, or maybe taking laxatives or diuretics. It's hard to tell sometimes if someone has bulimia nervosa because outwardly they can look sort of normal weight, maybe underweight or overweight, but the symptoms aren't always very obvious. So if you're worried about someone, you might have noticed that their relationship with food has become a bit problematic. So maybe you see them sometimes not eating much at all, sometimes eating excessively. Maybe they are disappearing to the toilet after eating because they're purging. Maybe physically they just don't seem that well. If someone's in cycles of restriction and binging and purging, they often don't feel at their best. They often feel tired, weary, dizzy. Often it's hard to concentrate. They're very preoccupied with food all the time. Sometimes people will experience heart palpitations or tingling in their limbs from electrolyte imbalances from bulimia. So if someone is really concerned about their symptoms, it's really helpful to go to the GP, maybe have some screening blood tests done just to check how everything is, check that everything is okay. So what about getting help for bulimia? Well, the great thing is people can recover fully from bulimia nervosa. And in therapy, there are many different ways that you can be supported. So I am working on the deeper issues and the symptoms when supporting someone with bulimia. And initially, one of the things I would do is help someone understand their story. What are the things in their childhood or from their environment that have made them perhaps feel not good enough, perhaps that has led them to turn to dieting as a way to feel better? What has maybe triggered the eating disorder, and what are the cycles that are keeping it going? So it's really helpful to have this psychological understanding to understand it better. Then someone is often very ambivalent about change, because the eating disorder is a coping strategy. So the next stage is to really work on motivation and to help you to feel empowered about change and to realize there is a life that is full of hope and promise beyond the eating disorder. Then there are many different aspects that we might work on in therapy. So from establishing a regular eating pattern to working on binging, working on giving up purging behaviours, tolerating anxiety around this, looking at our thoughts, looking at emotions, working on self-esteem, working on body image, working on self-compassion, just to name a few. So there's many different areas, and they all kind of fit together to really help you learn the skills and strategies that you need to become your own therapist so that you can kind of keep yourself well for the long term. So if you're ready to reach out for help, do contact myself or someone else on the Counselling Directory. You can find more about me, Harriet Frew, at theeatingdisordertherapist.co.uk, or you can listen to my podcast, The Eating Disorder Therapist.